Hey Lindsay, how you doing today?
I'm good, how are you?
Good, my name's DJ. I'm a student physical therapist under Dr. Clausen. Just going to work with you today. So tell me a little bit about this pain. I understand you're having some neck pain.
Yeah, I've been having neck pain for several years. It's kind of just off and on, but it's really sensitive. I can't even really touch it or massage it because it just hurts so much.
Yeah. So it's affecting your daily activity and stuff?
Yeah, I mean, I don't even want to do anything because I was told that I have a degenerative disc disease, I think.
Okay.
And I don't want to ruin anything. I'm too afraid to go out because I think I'm going to hurt myself a whole lot more.
So and that was the what you were told that your diagnosis was from the MRI you had?
Yeah.
Okay. Well, if you don't mind, has anyone gone through the MRI with you and kind of explained what that actually means?
No, not a lot.
Disc disease. Okay. Well, so most people, about 50% of people who get an MRI will actually show signs of small changes in their anatomy. Degenerative disc disease just means there's some small changes in your vertebrae. And 50% of those people those 50% won't have any pain symptoms. And so just because your anatomy's changing doesn't necessarily mean that that's the source of the pain. Not saying that you're not feeling pain or anything, but I think we could safely assume that the degenerative disc disease isn't the cause. I don't know, tell me what you think about that.
Yeah, I would maybe agree with you, but I just don't understand why I'm having so much pain.
Okay.
If I have this neck issue that they showed, then, where is my pain coming from if that's not it?
Yeah, that pain can be a loaded question. It's really confusing. Like, you've been working for years trying to get this figured out, and professionals are having trouble, right?
Yeah.
So, has anyone kind of ever explained the pain process to you and how we can kind of feel different things?
No, not really.
Okay, if you don't mind, I'm going to kind of give you an analogy of kind of how our nerves work and why they're there. So when you step on a nail or put your hand on a hot stove, your first reaction is to pull away, right? To get away from it because it hurts.
Exactly.
So our nerves are kind of like an alarm system, like a home alarm system. And its job is to go off when an intruder comes or something unwanted comes into our space, right?
Mm-hmm.
So just like the home alarm, if a burglar stepped onto your property, we want it to go off, okay, to warn you so you can do something about it or to get away from it, right?
Mm-hmm.
So that's the normal pain process. Once the threat leaves, the alarm, you'll go and shut the alarm off, or it'll shut off itself, and go back to normal and get ready for the next intruder to warn you of. Sometimes that alarm system changes a little bit, so the intruder comes, and when it leaves, the alarm system stays on kind of high alert. It doesn't necessarily turn off all the way. So now, instead of barking at the guy who was trying to break into your home, the alarm's going off at squirrels that are running in your yard, or dogs barking, or horns honking, and that's the nervous system being a little bit more sensitive to things. And then we can take it a step further where that system is so sensitive that it is always beeping. It doesn't really matter what it is, setting it off is just always kind of going. And that sounds like that's kind of the stage you're in, is where your system is kind of always kind of at peak levels, if that makes sense.
Yeah.
And certain things can add to that thing. Stressors in our life, whether it's stress from family or work or whatever, can actually make that system, your nervous system, much more sensitive than it normally should be. And so kind of what we're going to do through therapy is physical therapy is trying to work through ways to try and decrease the sensitivity of that system so that we can kind of get back to a baseline. I know we've talked about kind of home life and stresses you have there.
Mm-hmm.
Have you thought about reaching out for counseling or any sort of services that might be able to help you combat or deal with some of the stressors you have in your life?
Yeah, I've thought about it a lot, but I haven't really acted upon it.
Okay. Well, that's actually something that we know some people we can refer you to if you're interested.
Yeah, absolutely.
Okay. Because I think a combination of working on kind of the stress level from things that we can't really change physically, with physical therapy can actually do a lot to help with your pain, kind of reduce those levels, kind of get you back down to normal. But really, it's just being a little. Your nerves are on high alert because of all sorts of different things in your life, and
Yeah, that makes
this can really
sense.
help. So does that make sense?
Yeah,
Do
absolutely.
you feel comfortable with that plan going forward?
Yeah, I think I'm definitely willing to give it a try.
All right. Awesome. Well, thank you.
Thank you.